We're going to break a habit that, honestly, so many of us fall into. We're talking about taking powerful daily medications on total autopilot. Do you know the routine, right? Millions of people swallow a tiny pill every single morning, maybe glance at the bottle, and just kind of assume that because they can read the label, they know what the drug is actually doing. But, well, reading a label and understanding the hidden mechanics going on inside you, those are two entirely different things. So let's dive right in. I want to ask you something right off the bat, and I want you to really think about it. How confident are you that you truly understand what your blood pressure pill is doing inside your body right this second? I don't mean just the one little sentence your pharmacist printed on the white bag. I mean the way it really works, the way it can quietly turn on you under the exact right conditions, and the critical warning signs that separate a minor, annoying inconvenience from a situation where you need to call for help. If you're hesitating to answer that, don't worry, you are absolutely not alone. Okay, so here's our roadmap for today. We'll start with the autopilot danger, then take a deep dive into three very specific medications: Amlodipine, Lisinopril, and Losartan. After that, we'll talk about what happens on sick days, and finally, how to properly monitor your control. Section 1, the autopilot danger, breaking the habit. So we really need to talk about a massive issue affecting millions of perfectly careful folks. People who take their daily pills without ever recognizing when their own body is sending out a distress signal. Because here's the reality check. These pills, they aren't vitamins. They actively, fundamentally alter how your heart, your blood vessels, and your kidneys function every single day. Take a guy named Walter, for example. He's a 74-year-old, super organized former engineer. When his doctor added a new blood pressure pill, Walter just figured it was another pill. No big deal, right? Well, that simple assumption almost cost him a year of his life. Section 2, Amlodipine, Walter's heavy legs. About 3 months into taking Amlodipine, Walter's legs felt incredibly heavy. I mean, his feet swelled up so drastically, he literally couldn't fit into his shoes. He was terrified he was developing heart failure. But it wasn't heart failure at all. Walter's problem was simply that nobody explained the actual mechanics of his medication to him. See, Amlodipine is a calcium channel blocker. It lowers your blood pressure by relaxing the walls of your blood vessels, specifically the smooth muscle inside your arteries. By relaxing those walls, the blood can flow through with a lot less resistance. But here is exactly how that mechanism created Walter's terrifying side effect. When amlodipine relaxes the small arteries in your legs, the blood flows in much more freely. Think of it like opening up extra lanes on a highway. But the veins, the outbound lanes carrying the blood back up, they don't relax in the exact same way. The result? A massive traffic jam. More blood comes in than goes out. Pressure builds up in the tiny vessels down near the ankles, and it pushes fluid out into the surrounding tissue. It wasn't failing kidneys. It wasn't too much salt in his diet. It was just a highly predictable, mechanical response to the drug. Once his doctor adjusted his strategy, Walter was back in his walking shoes in a matter of weeks. Moving on to Section 3, Lisinopril, the relentless cough. I want you to meet Evelyn. She was 71, an avid gardener, who spent 11 miserable months blaming spring pollen for this relentless, dry cough that completely ruined her sleep. But Evelyn was taking Lisinopril. That is an ACE inhibitor, which lowers blood pressure by blocking a specific enzyme in the body that normally tightens up your blood vessels. But here's the catch. This exact mechanism is notorious for one very specific side effect: a dry, scratchy, relentless tickle right in the back of the throat. And what makes it so incredibly tricky is that it doesn't always start on day one. Evelyn's cough didn't show up until 4 months after she started the drug, so she never even thought to connect the dots. Once her doctor finally switched her medication, 11 months of utter misery was cured in just 2 weeks. So the absolutely crucial point here is understanding the difference between a total nuisance and a true medical crisis when you're dealing with the ACE inhibitor family. A dry, scratchy cough? Yeah, that's a major nuisance. You should definitely talk to your doctor about it. But if you're on the Lisinopril and you start to develop swelling in your lips, your tongue, your face, or your throat, especially if it makes breathing difficult, that is a medical emergency called angioedema. You do not wait until morning. You don't just take a Benadryl and hope for the best. You call 911 immediately because it can close your airway incredibly fast. Section 4, Losartan, the counterintuitive danger. This drug introduces a risk that's particularly wild because it usually happens when people are actively trying to do the right thing for their health. Losartan is an ARB, or an angiotensin receptor blocker. It works on the same overall blood pressure pathway as Lisinopril, just through a slightly different door. However, one specific quirk of this class of medication is that it can raise the potassium levels in your blood. Now, for most folks, this stays in a completely safe, monitored range. But if you add certain highly counterintuitive lifestyle choices on top of it, the whole picture changes. This is exactly where those hidden traps lie. Imagine a senior is told to cut back on their sodium. So what do? They go to the store and buy a heart-healthy salt substitute. They think they're doing a great job, but those products often replace the sodium with potassium chloride. So now they are liberally pouring pure potassium all over their meals, while taking a drug that already raises their potassium. Throw in some over-the-counter electrolyte powders for hydration, or maybe a meal replacement shake, and you've suddenly created a massive potassium overload. This can quietly push levels high enough to mess with the electrical system of your heart, triggering weird muscle weakness, total fatigue, or even irregular heartbeats.
Section 5. Sick days. When the rules completely change.
This right here is one of the biggest medical blind spots we see. I love this quote because it hits the nail right on the head. The medication didn't change, your body's internal environment changed. The exact same dose of Losartan or Lisinopril that is perfectly safe for a healthy, hydrated body acts dramatically differently when you get a stomach bug and end up severely dehydrated from vomiting or diarrhea. Without that normal fluid volume, your blood pressure can just plummet. Your kidneys become incredibly vulnerable. Basically, illness changes all the rules. And that is why having a proactive sick day plan worked out ahead of time with your doctor is absolutely essential. And that leads us to an incredibly common everyday hazard. Let's say your arthritis flares up, so you casually reach into the medicine cabinet for some over-the-counter ibuprofen. Well, ibuprofen, combined with these blood pressure meds, plus even mild dehydration, equals a substantial risk of kidney injury. Seriously, people just don't think of drugstore painkillers as real medication. But your kidneys, they don't care if a drug requires a prescription or if you bought it at a gas station. They only respond to the chemistry. And this specific combination drastically reduces blood flow right to your kidneys. Another side effect of this shifting internal environment? Dizziness. Just that brief, wobbly moment when you stand up a little too fast. Well, in older adults, just a few seconds of dizziness can cause a fall, and a fall can easily lead to a devastating hip fracture. It happens because the meds are doing exactly what they're supposed to do, lowering the pressure. But your cardiovascular system just needs an extra second to catch up against gravity when you stand. The fix for this is physically super simple. Rise slowly. Sit on the edge of your bed for a moment. Hold on to something stable when you stand up. Just give your body those extra few seconds to adjust. Finally, Section 6. Monitoring, managing the pattern. We really need to reframe how we look at taking blood pressure readings at home. We got to move away from sheer panic and toward actual empowered management. Because your blood pressure is not just a fixed number, it is constantly reacting to your environment. Think about all the daily variables at play here. How well you slept last night, your recent caffeine intake, whether you're in physical pain, if you're feeling anxious about taking the reading itself, or even if you were just talking loudly right before you sat down. A single high reading on a random Tuesday morning does not automatically mean your medication is suddenly failing. So here is the huge takeaway. Amlodipine, Lisinopril, and Losartan. They are not rescue meds. They require a steady, consistent presence in your bloodstream. You should literally never take an extra dose out of panic because of one high reading. And on the flip side, you should never skip a dose just because you have one surprisingly low reading. Reacting emotionally to a single isolated number leads to terrible, often dangerous decisions.
Which brings us to our final thought for today. The goal here isn't to just chase some random number on a digital monitor. The real goal is to track a consistent pattern over time, under the exact same conditions, and then let that pattern guide a smart conversation with your doctor. So I want to leave you with this question to ask yourself. Are you just reacting to your blood pressure, or are you truly managing its pattern? Because once you actually understand the mechanics of the medications you take, you stop being a passenger and you start taking real control of your health. Thanks for joining me on this explainer, and we'll see you next time.